Hi, everybody. Welcome to our expert series for Sense of Self. My name is Dr. Gauri Aragam, and I'm the host and creator of Sense of Self, which is a podcast about how to rewrite and reclaim the stories we tell and are told about who we are. And today, we're lucky enough to have Dr. Sofia Noori with us. Welcome, Dr. Noori. Dr. Noori is an adult psychiatrist, also a trauma expert, who's the founder and CEO of Nima Health, which is an online trauma therapy platform founded by experts in PTSD. So welcome, Dr. Noori. Thanks so much for being here with us.
Thank you. I'm really excited to be here.
Yeah, and today I think you're here to discuss the first episode of Sense of Self, Akemi.
Yes.
And I think the theme of our conversation is what does it take to move towards yourself after trauma and find your voice, which, given your expertise, I think is completely up your alley. And I'm so glad you're here to discuss this with us and share your perspective. And so I think I often start out these conversations by kind of sharing with you and everyone else that, ever since the podcast came out, we've received really wonderful responses from the audience about how these stories are really resonating.
Mhm.
And Akemi's story is absolutely one of those. We've received so many messages about how her story, whether she told it, the themes of it, whether it's her immigrant background or her experience with abuse, or even her kind of redemption story, for lack of a better word, has been inspiring for so many. And I'm just curious, and they've learned a lot. So I'm just curious from your perspective, based on what you listened to and what you heard, kind of why you feel like it's resonating so much.
Yeah, I mean, I think the Akemi story is so relatable in so
Hmm.
many different ways. Like she talked a lot about her like mixed heritage as well, and like straddling different cultures in like different settings, and how that also like put pressure on her in terms of like wanting to fit in. And then she also talked a lot about which I think is something that happens to not only like people of color but also a lot of women. Like she talked a lot about gaslighting as well, and like the culture of sport, which can frankly be quite toxic. And I think like that the themes of trying to find her own voice, which literally and figuratively, after she had the jaw injury, I think is like such a like universal like human theme in a lot of ways too. So I can see why it really resonated with folks. And unfortunately, trauma is really common too. And
Yeah.
she spoke a lot about how her traumas have affected her as a person. And we know that, you and I both know that like over 80% of Americans will suffer a trauma in their lifetime. And so I think like her story of how she overcame, a lot of different types of adversity, and also how she processed through some of her trauma in a very public forum too, is really relatable.
Yeah, and I'm so glad you feel that way because I think that was so the goal that Akemi had as
Yeah.
well in sharing her story. She was hoping that it would be relatable and that others could learn kind of from what she experienced. And I think, one thing you and I have talked about, and that is, I think, close to both of our hearts and kind of why we're both advocates of trauma treatment, is because it's so common and oftentimes can go unnoticed, undiagnosed,
Yeah.
and then is labeled as something different and can lead to downstream, issues with addiction, let alone depression, anxiety. And just, given the title of the podcast, Sense of Self, we know that there are certain symptoms of PTSD, kind of formally, that directly impact kind of how a person can feel about themselves and what they
Yeah.
believe about themselves to be true. And that can last for their whole life if gone
Hmm.
untreated. And I'm just curious, how you've seen that show up in your practice and work, this idea of the trauma itself impacting a person's sense of self.
Yeah. Great question. I mean, I think it's such a fundamental, like, well, first of all, it's like, it's probably the biggest way that trauma has impact on someone is it impacts their sense of their identity, right? And that is also actually like one of the symptoms of post-traumatic stress disorder. So one of the categories of symptoms of PTSD is what's called negative cognitions and mood, right?
Mm-hmm.
And in negative cognitions, when we talk about negative cognitions, it's like these thoughts that, like these beliefs that people start to develop after trauma has happened, because they're trying to make sense of why the trauma happened to them, right? They're trying to
Yeah.
make sense of something senseless. And oftentimes, they're trying to come up with reasons. And oftentimes the reasons are, what could have I have done differently to prevent this trauma from happening to me? And unfortunately, like when something senseless happens to you, something like senseless or random, right? And but you think that the world should make sense, right? You come up with a lot of faulty different conclusions that often have to do with you, right? So
Yeah.
what happens is after trauma, sometimes people blame themselves because it happened, right? Or they think that they're bad now, because it happened to them, right? Especially like with sexual assault victims,
Yeah.
victims of people of like interpersonal violence, like domestic violence as well.
Mhm.
And it just shatters their sense of self and self-esteem. If you think like, I deserved this, right? It's my fault that I was abused. If I had worn something different, this wouldn't have happened. If I fought back, right? All of those things, when you're ascribing blame to yourself for something that you literally could not have foreseen, really shatters people's sense of self. So I think it's unfortunately incredibly common, and it honestly it takes time, and you have to take a step back to really see that that's what's happening, because also like society blames survivors all the time. And I think Akemi also like talked about how gaslit she felt in so many different types of arenas.
Mhm.
So she like naturally was led to the conclusion that a lot of what was happening was on her.
Yeah, and that kind of totally right. I think that leads me to kind of my next question for you, which is kind of building on what you just said, which is that when you're trying to make sense of something that is senseless, and where are you looking to make sense of it? Where are you looking for explanations, right? And especially if you're a child, which in Akemi's case, she was still a child, right? She's an adolescent, kind of in her developmental stages of identity. And as you mentioned, like, where was she looking? Where do others look when they're a child for explanations of this? And if that environment,
Yeah.
those people, those role models, the people, the caretakers you have, whether that's a parent, a teacher, a coach, a doctor, are telling you something that goes against what you're feeling inside. In her case, it was, she had broken a rib. Yeah, I
Yeah.
think she had an
Yeah.
injury. Yeah, and was told that that just didn't happen, right? You start to not trust yourself, right? And I
Yeah,
think there's
exactly.
something about the connection with trauma and the body that we also talk a lot about, right? Where
Yeah.
there's so much of that lack of trust that happens once you've experienced abuse like that, when it's compounded by the environment around you. Um, and there's two questions from that, but I'll start with the first one, which is to talk a little bit about kind of the impact that that kind of trauma can have on your body. Again, relating it back to your sense of who you are in
Yeah.
your own self.
Yeah. I think there's so many ways that it can impact your body and also your
Yeah.
perception of your own body, like not even
Hmm.
just like the physical sensations, but how you think and feel about your body, right? And your
Yeah.
attitudes towards it. And I think
Hmm.
like especially with Akemi, like and unfortunately I think this is actually really common, especially with female athletes and gymnasts, but
Hmm.
she literally was told that like she like that her like the pain in her ribs didn't matter, right?
Yeah.
And she worked through like broken ribs until she got an MRI that proved that she actually had broken ribs, right?
Yeah.
And so she had to deny her own pain and like her own experience of her body, right? And that often happens with trauma survivors in general. It happens when they're actually experiencing the trauma, right? Like oftentimes if it's like a physical assault or something like that, it's not, they don't feel safe in their body, and so they literally try to retreat almost into their minds, and
Yeah.
we often call that dissociation, right? And when someone tells you that you're the what you know to be true is not true, right?
Yeah.
Especially if it's pain or a physical sensation,
Hmm.
then you don't trust yourself anymore, and you don't trust your body, and you essentially turn off from it, because you're trying to either escape from that experience, or you're trying to align your experience with the fact that somebody's denying that it's even happening, right? So it must not be happening. And so again, this is a very common symptom in PTSD, because after that happens during something that's like incredibly life changing to you,
Yeah.
you continue to practice it oftentimes because the trauma symptoms keep coming back, right? Like the memory of this like horrible event keeps coming back to you, and the way that you're going to respond is by withdrawing. And so I think what happens to people's bodies after trauma is that they often just don't have the same sensations in their bodies. They don't like perceive the same feelings within their bodies. They often like devalue their own bodies too, because
Yeah.
I mean, what's the point of feeling things or taking care of it if it's just going to betray you in some ways, right? So I think there's a lot that happens, and we also know a lot about somatic symptoms too, right? Which
Yeah.
are somatic symptoms or physical symptoms that are manifestations of often trauma or just like distress, right? And
Hmm.
oftentimes we know that when people are traumatized or hurt, they often develop pain in those parts of their bodies. Like a lot of
Yeah.
assault survivors develop pain with sex, right? And things like that. And the pain is very real, right? It's being manifested from some of their emotional experiences. So there's so many different ways that trauma affects people's bodies. And it's just when you aren't able to acknowledge it
Mhm.
because of various different reasons, you withdraw.
Yeah, and I think that's so extra true, because a lot of my background is also, and yours as well, right? Working with women of color, other like immigrant women of different backgrounds, and this idea of tension being kind of a catch-all phrase,
Yeah.
and how somatic symptoms are far more prominent in women
Yeah.
kind of color, and a lot of immigrant women, our families respectively, right? And how many
So
times
true.
have we heard that growing up, right? I didn't understand it back then because, I wasn't a psychiatrist, but it just became sort of part of, oh, that's just how women are, and these cultures start to really permeate. And so I think there's something about that bodily experience where that can sometimes be the way that people express the pain when oftentimes they're otherwise shut down or gaslit or not even
Yeah.
given space to speak of their experience,
Exactly. Yeah.
right? And that's so much more common with women of color. And we see that with the Akemi story. We see that with so many other patients, family members, friends. And I think that there are so many ways we could go and expand on this conversation right now. But I think one way I really wanted to one way to steer this conversation was also um, to go back to this idea of environment in both
Hmm.
pre-trauma and post-trauma, because whether it's sexual abuse, emotional abuse, verbal abuse, oftentimes you're brought up a certain way to believe that something like that is either your fault, not okay to talk about.
Hmm.
Other families where there's actually some education done, so you feel like you're empowered to say something if something bad has happened to you, which is really nice, and I've seen that more so. And then after the fact, where it's like, hey, am I going to feel supported by the community that I'm in, by the caretakers that I
Hmm.
have, the friends that I have, and how does that lead to, how does that shift prognosis in terms of, getting over either PTSD, the trauma itself, let alone like downstream, consequences that you were talking about. So yeah, I guess the question there is like, how can the impact of trauma be influenced
Yeah.
by family values, upbringing, let alone your kind of general community environment?
Yeah, well, great question. There's so many different ways, but I'll try to focus on
Yeah,
a few. I
sure.
think there's a huge component within families and communities of like intergenerational trauma, right? A lot of communities have suffered trauma for generations, right? If we think about folks who have survived the Holocaust, like and having children after, folks who've survived, come like refugees who have come after war, right? We know that the children of those trauma survivors often tend to be more anxious, more prone to like mental health issues, like developing PTSD if they suffer a trauma as well, right? And just have just higher stress in general, right? And so I think that some communities are unfortunately primed to sometimes develop PTSD because of the baseline stress they already have, right? And we
Hmm.
know that after somebody suffers a trauma, one of the things that also predicts whether or not they develop PTSD is support, and whether or not they have folks to provide positive support to them, because
Hmm.
one of the risk factors is not having that support, and
Yeah,
is having folks around you blame you, right? Or oftentimes, in trauma therapy, we talk about stuck points, which are essentially thoughts that lead to painful emotions that don't dissipate. So
yeah,
painful emotions like shame, embarrassment, right? Thoughts that you have about why the trauma occurred that make you feel guilt or shame or embarrassment, or that you can't like move on with your life, right? And oftentimes what makes survivors develop stuck points, like it's my fault, is because literally somebody told them that, right? Or
yeah,
they know that the society around them is going to blame them, right? So I think that's also, Akemi talked a little bit about this, but she talked about how, with Larry Nasser, she was so confused about what was happening. She wasn't sure. And, on top of that, she was literally being told that her rib wasn't broken, right? And so she probably had a stuck point that was like, it's not like it didn't happen to me, right? Or no trauma even happened to me, because that's what people around her are telling her, and then she absorbs it. And so unfortunately that happens a lot with people. Like think about assault survivors who are told, well, what were you wearing? Right?
yeah,
They're making an assumption. The stuck point there is, if you were wearing different clothes, maybe you wouldn't have been assaulted. But there's no research or evidence to show that that's even true, right?
yeah,
That's just something that people assume. That's not
yeah,
true. that can actually lead people to develop PTSD because they can't get let go of the trauma and they keep blaming themselves for it.
Yeah. And I think this idea of stuck point is so important because I think this is what we're getting at, because that can be a stuck point for your whole life, right? I mean, I
Yeah,
remember one of the first
exactly.
patients I remember that one of the first times I ever came across somebody with very clear PTSD in residency was a woman who was probably in her mid 80s and had experienced a sexual assault when she was in her early 20s and had never gotten treatment for it, and had, gone through multiple relationships, just like kind of classic signs of kind of emotional dysregulation and kind of intolerance of romantic relationships and physical
Mm,
relationships.
hmm.
And even at her, age of 82, she had been admitted to the psychiatric hospital because I think of kind of intense like suicidal ideations and depression. And when I was talking to her, that was her stuck point, right? Like for all that
Yeah,
time, she had been like, well, if I just locked my door,
yeah,
and this is like a random intrusion. It wasn't something, it was like a random intrusion that had happened to her. But her stuck point continued to be that, and there had never been any chance for her to work through it. And I
wow.
bring that up because it's something I share with my patients too, where so many times people come to me and they're just like, oh gosh, like this happened 20 years ago and I'm just starting to work through it. Like what a waste of my life. I could have done so much had I just worked through this earlier. And I oftentimes have to remind them that you're doing it now though. And, you know,
Yeah, yeah,
you could have
exactly.
you could have had 40 more years where you never had a chance to deal with this, and now you get a chance to
Yeah,
live that life for those years, or where you're working on that and you're giving yourself the
yeah.
chance to do that. And I wonder if this is, more just less of a question, more of a statement that I'm making that I want you to maybe
Hmm.
share with and kind of share your perspectives and experiences with, because that to me is also something that is so important, I feel like, for people to realize when it comes to the flip side of this, which is healing and kind of moving forward
Yeah,
in terms of finding your voice, right? I mean, there's this kind of idea of it's never too late to find your voice, but that's really true. And so I think if we could shift gears a little bit and now talk a little bit about like that part of the journey, if you will,
yeah.
would love your thoughts on kind of just the idea of, yeah, it's never too late to do that, and those stuck points could otherwise stay with you. So like, keep on keeping on, right?
Yeah, yeah, would be happy to. I mean, this is literally the like my life's work and like what we do
Yeah,
at Nema Health too with our clinic that focuses on trauma is like first of all, like our patients on average have suffered from PTSD for 14 years before finding us. So their trauma was on average 14 years ago, and we see folks even 60 years, 80 years out of their trauma and they
yeah,
still are able to recover because once you understand that some of these stuck points are not you necessarily, like there are thoughts that you have, right? But they may or may not be true. And you're able to kind of really step aside and think about them in as logical a way as possible. You
hmm,
realize that those thoughts aren't necessarily true, right? And you're
yeah,
able to change them. And that's really powerful for folks because it releases them from the shame and the guilt and the embarrassment. And
yeah,
then, when folks like tell them like negative cognitions or stuck points, they're able to notice it and realize that they aren't true and not take on the blame. For example, unfortunately I was assaulted in college and it was essentially like a date rape. And when I told my a family member about it, she said, you have to lock your doors. And you know
yeah,
that had nothing to do with why my particular incident occurred. Right? And again, it goes to kind of what your patient thought, Gary, that like if
yeah,
you lock your doors, you're safe, right?
yeah,
Which we know is not true,
yeah,
right? People often weaponize your trust in order to like gain access to you, right?
yeah,
And so I think once you understand that these things aren't true and you're able to see that other people can have these types of thoughts, you can decide if you accept that or not.
yeah. Which is, and yeah, I think that also goes to sort of like the step by step nature of this, like the idea of practicing being able to step back and even be aware of the fact that thought pattern is occurring, right?
Yeah.
And
Yeah.
being able to choose differently, which is so much of, I think, what you help people with, let alone just generally speaking, right? The goal of trauma therapy. And that also leads me to another goal of trauma therapy, which is, I mean, your company and what you specialize in is also cognitive processing therapy, and that is literally, steeped in narrative, which is kind
Yes.
of the
Yeah.
ethos of sense of self. It's all about rewriting, reclaiming narrative. And I think that really aligns, I feel like, with the treatment goals of trauma therapy, cognitive processing therapy specifically. And I would love to chat a bit about kind of even just your reflections on this idea of the importance of rewriting and reclaiming narrative, specifically narrative that, again, you're telling yourself, whether it's because
Hmm.
of these negative cognition, stuck points, let alone what you're being told about
Yeah.
yourself. You should have locked your door. That means you're irresponsible, right? Like you're
Yeah,
getting these messages
exactly.
from everybody else about you. And so, what is it about being able to reclaim that narrative? Like, that can be so powerful.
Yeah, yeah, and I think that's a great observation too. That so much of trauma therapy is actually reclaiming narrative, right?
Yeah.
And then also just to back up for a second, so not all therapy. People are often like surprised to find out that like not all therapy is trauma therapy.
Yeah.
And
Yeah.
there's a difference between trauma informed therapy and
Yeah.
trauma therapy itself, right?
Yeah.
So
Please.
when
Yeah.
people, yeah, so when people say trauma informed, that often just means that the therapist is like willing for you, is like okay with you talking about your trauma, not that
Hmm.
they're actually trained in a trauma therapy or a PTSD treatment. And what the PTSD treatments have in common is that they're generally actually very short to complete, about 10 to 12 sessions, and they generally lead to permanent recovery if you get one of the two first line treatments, which include cognitive processing therapy, CPT, and
Hmm.
prolonged exposure, PE. And both of them are actually really about narrative because so much of having PTSD is changing the way that people think about themselves. And that's often like the mechanism of how they work, right? And making you see that your trauma is not the scary bogeyman. It's actually the what you think about your trauma that's really holding you from looking at it, right?
Yeah.
Because it's so steeped in shame and guilt. And
Hmm.
so, when it comes to cognitive processing therapy, one of the first things that you have to do in it is you have to write an impact statement. And again, this is not actually a statement. And I think another myth about trauma therapy is that you actually have to tell every single detail of your trauma to get better. And again, because recovering from trauma and recovering from PTSD is not just about the story, it's about the story you tell yourself. That's
Yeah.
actually not true. So you actually
Hmm.
don't have to share your full, like every gory detail of your trauma with your therapist. And you can also have many traumas and still get better because it's the story you tell yourself about your life, right? That
Yeah.
is keeping you from living the life that you want to live.
Yeah.
So in CPT, you write what's called an impact statement, which is how has the trauma affected you and your life and how you see yourself, right?
Yeah.
And from that, we actually will mine that essay essentially for stuck points, so that you can really start to step back and look and say, gee, like, I can't believe there's all of these things that I think about myself. Like,
Yeah.
I'm bad, I'm dirty, right? It's my fault it happened. I'll never find love because this happened to me. And then when you actually like take an appraisal like that, and you put it down on paper and you actually start to systematically look through that, you start to realize that a lot of that actually isn't true,
Yeah.
you know? So that's what trauma therapy does for folks is it helps people kind of like apply their critical thinking skills to something that really, really scares them in a very systematic, safe way.
Yeah. And like I really appreciate you kind of differentiating between trauma informed and trauma therapy in this setting, right? Because agreed, I have had so many patients where I've had to explain to them, oh, those are actually very different, and they get confused as
Yeah.
to why they're not better after having trauma informed therapy. And it's like it's wild to me, right? It's wild to I think both of us that that is not something that people are educated about by their clinicians, by people who hopefully would know more. So I'm really glad that you're doing what you're doing. I'm glad that we're on the same page about these things, and that
Yeah.
we get to be here together and like talk about it, let alone kind of act on it. And what you're talking about also is this idea of the story you tell yourself about your life and the stuck points. I mean, that is like the basis of each story in sense of self. And sometimes it's a trauma, sometimes it's just life and things that we go through. And I think the same principles still apply, right? This idea of stuck points, so much what we do in therapy in general is help people kind of work through those. And that comes to how does that process then help you quote unquote find your voice, right? And I think before answering that question, the question is, what does it even mean to find your voice? And I think you are getting to that, right? And maybe not in those words when talking about the process of cognitive processing therapy, for example, right?
Yeah.
So I'd love to hear
Yeah.
from you sort of, yeah, like what does it even mean to find your voice
Yeah.
to you?
I mean, I think within the context that we're talking about, I mean, I think
Mhm.
that
Yeah.
finding your voice is finding what you truly believe in a way where you're being mindful of like the influences around you too, because I think oftentimes people don't find their voice because they feel like they're being kind of drowned out by the society around them, right? Or silenced by other people. And for trauma survivors, I think finding their voice involves a lot of release that their trauma could have been, that they could have changed their trauma, frankly, and that they're to blame for their trauma. I think those are like the two fundamental pieces that a lot of survivors really struggle with. And then they come up with a lot of different conclusions about their lives that just aren't true.
Yeah.
And so, one of the things that we do in the trauma therapy is that actually at the end of the therapy,
Hmm.
you rewrite your impact statement. You
Hmm.
rewrite the prompt, around how has your trauma, now what do you think about how your trauma has impacted yourself, your views of the world. And this time though, because you've had so much more self-awareness, you're more able to choose what that means to you. And so I think a lot of finding your voice is also like kind of deconstructing what you've
Hmm.
been told about the world.
Yeah, and I think it's like it's kind of the ultimate goal. Like that new impact
Yeah.
statement literally is meant to be kind of you and what you are telling yourself, um, as yourself, right? Which I think is very powerful, and I think not to be taken lightly. And again, I don't mean to diminish the phrase "find your voice," but I know that it's used quite widely, and I really wanted to make sure we talked about it, yeah, in this context because it is an actual treatment goal. Yeah, and I think another question I had for you was, we talked about the podcast episode, but you alluded to something earlier where you said, yes, there can be one trauma, one moment of abuse, one experience of abuse that can lead to PTSD. There can also be a series of abuses, right, throughout the course of your childhood, throughout the course of your life, that can also lead to immense suffering and can be harder to tease apart because there's just so many. And they don't necessarily have to all be of the same kind of abuse, right? You could have sexual
Yeah.
abuse, you could have emotional abuse, verbal abuse, oftentimes within the same relationship or the same family. And so it can be hard to differentiate between kind of all these instances when they kind of are happening so often, let alone
Yeah.
sometimes they can even be like the water that you're swimming in. And that brings us to the idea of complex trauma, which oftentimes is a diagnosis, a group of symptoms that tries to explain the impact of kind of these series of incidents and experiences. And I'd love if you could share more about kind of complex trauma.
Yeah. Yeah, I'd be happy to. And for those listening too, sometimes complex trauma is also called complex PTSD. And recently there's been a movement to like make a distinction of like complex trauma or complex PTSD from like just quote unquote like classic PTSD. And it's been quite controversial because also like the diagnosis of PTSD is actually quite broad, but the way that people think of it, like the stereotype of somebody with PTSD is like generally a veteran that's coming back from war, right?
Yeah.
And the reality, though, is that actually 85% of all PTSD cases are in civilians. And the traumas that are most likely to cause PTSD are actually rape and domestic violence, like interpersonal violence. And combat trauma is actually third most likely. So when we actually think about PTSD, the folks that are most commonly impacted are actually women and also people of color, oftentimes, right? And again, interpersonal violence like rape, domestic violence, child abuse are more likely to cause PTSD. And so I think that when people are talking about complex trauma and complex PTSD, they're often trying to highlight the fact that, ongoing traumas lead to PTSD symptoms that
Mhm.
often don't look like a classic, sort of presentation of like a combat veteran coming back from war and having nightmares, but actually this like the idea of of somebody suffering multiple traumas in their life with like child abuse or domestic violence or rape, right, and continuously being in an unsafe situation, that's
Mhm.
actually a more common presentation of PTSD.
Yeah.
And so I think in some ways what's happening is that I personally don't think of complex trauma and complex PTSD as a separate diagnosis. I think of it as like a variant of just PTSD, a certain type of clinical presentation of it that is actually the most common type. And it's very, very rare actually to see people who have just a single, what we call a single incident PTSD. They were mugged once, right? And then developed PTSD and have, quote unquote, classic symptoms of it like nightmares, which are actually really rare. I think what we're all talking about is actually just PTSD. It's just that the prevailing idea of what PTSD doesn't actually is actually very rare. It doesn't actually look like what most of it looks like in the community. So I think there's a huge under recognition actually of complex trauma and complex PTSD. And I think people what this movement is doing is helping people recognize that when somebody survives trauma, they often survive many, many traumas,
Yeah.
and it affects every part of their being, right? It affects their personality, it affects how they like interact in relationships, it affects their concentration, and some of that looks like ADHD, some of
Yeah.
that looks like just depression, right? Some of
Hmm.
that looks like borderline personality disorder, right? And having suicidal thoughts. But actually, not to get like too scientific about this, all of those symptoms are actually
Yeah.
still symptoms of PTSD.
Yeah. This is something I'm so glad you're talking about because I feel like, I'm in my current job not a therapist anymore for right now. Go back to it. But, trauma informed psychiatry is super important. And I think this is, I mean, I think every single patient of mine that I have seen, or if not the majority, and especially every female patient, and especially every female patient of color that I have, has a kind of story like what you're describing, which, as you were
Yeah,
mentioning, is kind of the most predominant one. And I think what we were getting at earlier is that sometimes in these groups of women, let alone people in general, when you are subject to one instance of abuse and you start to feel as though there's something wrong with you or you are bad, that inherently can put you at risk for subsequent
exactly. Yeah,
abuses, right? Which then compounds on itself and only reinforces this belief you have about yourself. The stuck point stays that
exactly.
much more stuck,
Yeah.
especially when you're totally unaware of it. And I think that's what is so difficult because so many times family members can see people behaving a certain way and don't realize that sometimes these people just aren't aware of it.
Yeah.
And that doesn't excuse their behavior by any means, but I think in terms of building compassion and understanding and actually facilitating people to get the kind of help that they need, it would be so wonderful if people could kind of notice some of this stuff
Yeah.
and instead of shunning, maybe checking in,
Yeah,
you know,
exactly.
instead of us out sidelining, checking in, leaning into it. Um,
Yeah.
and
Yeah.
that, especially in, I mean, in family systems, right?
I agree too. I think there's like an under recognition of those symptoms and how significant they are, and also I think people oftentimes don't realize that because they're trying to make a distinction between complex trauma and regular PTSD. They think that the treatments for complex trauma or for somebody who's had multiple traumas is different, and they're actually
Mhm.
not because all of the research studies were basically done on people who have complex trauma, since it's frankly the majority. So if they've done with the trauma therapies, they've done research on, rape survivors who've been repeatedly, traumatized and shown that they still work just as well. Because frankly, that is the most common presentation of PTSD.
Yeah. And again, like that leads me to asking a little bit more about what you do. And so we've talked a little bit about NEMA and how that's like your most recent venture, and how it kind of
Yeah.
provides online trauma therapy. And we've talked about cognitive processing therapy, at least mentioned it. But yeah, would you mind just sharing a bit more about
Yeah, yeah, I'm
NEMA?
happy to. And, I've always been really motivated to work in trauma and PTSD, not just as a clinician, but as somebody with lived experience too. So
Mhm.
my family survived the Vietnam War and we're refugees here. And then, unfortunately had my own lived experiences of trauma too and developed PTSD. And so I've always been really personally motivated, and it always rattled me that folks didn't recognize PTSD as much in civilians because it's so common, and especially in just the populations that I was serving as well, it felt like it was so common, but we couldn't get people into trauma therapies for a number of different reasons, and it can be really hard to get trained in them too. And so at NEMA, really our goal is to be like a national center of excellence for PTSD treatment for veterans and civilians, and also to do the therapy as fast as we can with folks so that they get better as quickly as possible too, and get back to like lives that they want to live. So we do all of the first line treatments for PTSD. We see folks, with any type of complex or just PTSD, and we also do a lot to help support them because social support is so important. So in our model of care, folks
Mhm.
get assigned to a trauma therapist, but also to a peer which is
Mhm.
somebody with lived experience of trauma who's in recovery themselves and
Mhm.
can support them through it. And then we also sometimes assign folks to psychiatrists, but medications aren't first line treatments for therapy. It's or for trauma. It's really actually therapy, right?
Yeah.
As we talked about,
Yeah.
changing your understanding of your own sense of self, right? And
Mhm.
so it's tough work. It's emotional labor to do it. So we just really try to support people as much as possible through the program. And another big thing that we have focused on is taking insurance and making this accessible for folks, because it should be as affordable as possible to get trauma therapy.
Yeah, no, that's really great. And I think I want to underline what you said in terms of like therapy really being the first line treatment for trauma. And I think kind of that the misconception that medication often can be. And I think when I explain to my patients, and I'm curious on how you explain to people you work with, I often say that medication helps you kind of tolerate the process sometimes, right? Because sometimes the emotions can get really big
Yeah.
if you've not, if there is complex trauma, if there are multiple, and if, this is compounded to the point where it's kind of
Yeah.
intolerable and, experiencing those big emotions might actually lead to them stopping treatment, right? Because
Hmm.
it's just too intolerable. And so medication can help with that sometimes, make it a bit more tolerable, and it can help kind of um, facilitate the new learning, the new learnings. And
Yeah.
I think that's kind of what all these like neurobiology studies show in terms of like the impact of antidepressants, for example. But yeah, it's not necessarily the treatment; it's just facilitating
Yeah.
the work that's
That's
being done
exactly.
in therapy.
Yeah, that's exactly how I explain it too.
Yeah, that's great. Yeah,
Yeah.
and I think it's helpful, right? Because then it just makes it less of a people don't think they have to take a medication to get better. That being said, there's also you can't just take a medication to get better. There is this kind of emotional labor that goes through it, and
Yes. Yeah.
yeah, it makes sense that people kind of want to, you want to kind of fortify someone before they kind of go into that emotional labor and
Mm.
provide them with the support they need, which is, kind of in the form
Hmm.
of, peer coach, let alone, the treatment team. So yeah, thank you for what you do, Sophia, and to your whole team.
Thank you. Thank you for
And
what
thanks
you
for,
do as well, for
yeah,
helping
and thanks
people
for
find
being
their sense
here
of
with
self.
us. I'm sorry.
Yeah. Oh, I was just saying thank you for what you do as well for helping people find their sense of self, like also in this podcast.
Yeah, no, it's been an experiment totally, but it was very much
Yeah.
rooted in kind of the everything we talked about today was kind of the inspiration for why we did this way. And I think speaking of which, there's a question we ask all of our guests who come on is to kind of, the podcast showcases how the liberation of an individual can lead to the liberation of a community. And I was just curious, what that means to you.
Yeah. I mean, I was thinking about this for a little while. And I think, everything like there's so much of life that feels like it comes in cycles, right? That you almost like can be a self-fulfilling prophecy based on what you believe, right? And I think we often project onto other people, right? That's often why we share our like stuck points with each other, like,
Mhm.
okay, what were you wearing? And when you're able to actually find your own sense of self, you stop doing that and you kind of break that cycle in a lot of different ways. And I think, especially when it comes to trauma survivors, when trauma survivors actually recover, they're just like, and they gain their like sparkle back. It's like just the most amazing thing to see. And they often want to give back and really kind of like disrupt that cycle of trauma and shame, which I think is just so amazing and is something that can really like bring society upwards.
Yeah. Well, thank you for sharing that. I appreciate it. And I appreciate your support of the podcast and of this work. And yeah, just thanks for being here. And thanks to everybody for listening. And we'll catch you next time.
Thank you.
Yeah.